Good morning to everybody. I think we are all enjoying from morning. Dr. Sanjiv probably does not require any introduction, but it is a customary to introduce the speaker. He is, as you know, Professor of Pediatrics at St. John's Medical College, one of the prestigious institution, and he is also an adjunct professor of Pediatrics, School of Medicine, University of Maryland. His special interests are in critical thinking, clinical reasoning, disaster medicine, clinical ethics, HIV medicine. We all talk about professionalism, how to do authenticated assessment. So let us hope his ideas on assessing professionalism, whether we are really doing on, whether it is effectively done. I think he will throw some light on that.
Check. Good morning, ladies and gentlemen. We're running 45 minutes late, so I decided to bring the laptop here to speed it up. I'm not sure about the light part, but we'll certainly try and at least confuse matters going forward. The topic given to me was on professionalism in practice, more specifically that all that counts do not count. And we're talking about assessment of professionalism in practice. My name is Sanjiv Lewin, as was introduced earlier, and thank you very much for that kind introduction. At the onset, a sincere thanks to the iCON 2023 team for having me here, for having tolerated me here. The session we plan is, do we need to assess what is professionalism, where in Miller's, what content, what tools, what assessment error works well, who should judge, what is PMEX, is there utility of whatever we're trying to plan for, what next, and is there a blueprint? So the first thing is, do we need professionalism? It's very clear that, especially in India, we've had a massive increase in commercialization of healthcare. We have expert Google doctor patients. The doctor-patient relationship has changed. Access to information, and not even that, by remote means. The legal system and the physician's attitudes and priorities have certainly changed. These are professional dilemmas which we are all facing in today's world, and therefore it increases the need for professionalization. To remind us about what is professionalization, I love this UK definition of it being a set of values, behaviors, and relationships, and most important, that it underpins the trust the public faces in doctors. And we can see why we're having a major issue with professionalism in India with the last statement. When you look at the framework of capabilities expected of a professional, you have this wide circle of professional knowledge. You have a professional skill circle, but in the core of a doctor's professional methodology of how he deals with people is the professional values and behaviors. So therefore, if it's such a core substance in the making of a doctor, one wonders why or how can we actually assess this professionalization. I love this diagram because it tells me about the foundations of what makes us professional and the pillars which support us as professionals. Right at the bottom is we all have to be competent. We all need to be good with our communication across all areas of team members and stakeholders. We must be aware of ethics and legal responsibilities, and the pillars being excellence, humanism, accountability, and altruism. And that's what really holds up professionalism. And this pillar and foundation is probably what we have to assess, which makes it easier for me to say there's no way we're going to assess this with 4.5 years, with 250 students, and maybe 4 faculty members as per NMC. And that's what we were discussing out a little earlier. So what in Miller's should we assess? We repeatedly saw Miller's, and we realized that Miller's is about knowledge as well as behavior. Do we assess the knowledge of professionalism or the behavior? Because we have to choose. And when you look at that, for us to choose, and when you look at the affective domain, the hierarchy of the affective domain, I will certainly need certain knowledge when I need to be aware of professionalism or unprofessional behavior. And when I take decisions in dealing with professional conflicts, again, I need to have some knowledge. So therefore, I think the answer is we will have to evaluate and assess knowledge and behavior when we talk about professionalism. Just to define and remind ourselves, knowledge is all about the know and the know-how. Competence is about what we can do in clinical practice, probably demonstrated in artificial situations. However, the ultimate professionalism is dependent on us demonstrating, not really demonstrating, but actually performing in the workplace. So to talk about professionalism and assessment without workplace assessments is going to be near impossible. Remember, the know and know-how is cognitive, and as we improve the authenticity of the setting in which we assess, the does and shows how approaches the competence and performance. What content should we assess? Since 1963, my institution has been teaching clinical ethics. So I'm fortunate to have been part of that team from 1993. I'm a preacher of ethics, just as a disclaimer. I'm a preacher of ethics, but not necessarily a practitioner. When you look at the curriculum, in the preclinical subjects, we did values, beliefs, etc. And in the clinical, we began to teach about clinical issues. Being a Catholic institution, the beginning of life and end of life becomes important, but we also discuss doctor-patient relationships, transplant, research allocations, pharmaceutical industry, as well as relationship with doctors, research, and we do tackle interns. And now in the last 5 years, we've begun a clinical ethics program for postgraduates. However, we have really delayed in the assessment. Our assessments traditionally used to be a signature in the logbook when you attend, and we had a prize exam, which became very popular because people's resumes and this book called The Wisdom of Crowds is very interesting. It had nothing to do with medicine, but when they looked at it in context of medicine, typically assessments were done by one individual by another. An individual method such as a knowledge exam. And what was clearly described is that a group judgment may provide the best means of maximizing the reliability of decisions or judgments we take. And so it's interesting that that became essential when you look at professionalism, which tends to be very different. And this, in Hemmer's article, really scored out and came very clearly that evaluation sessions are much more good at detecting professional behavior or inadequacies of professional behavior. Certainly, it again points out that if you are in the ward assessing behavior, it's much better than in ambulatory, presumably outpatient clinic areas. So go to the ward where the student or the doctor is working and look for professionalism there, because that gives you truly what's happening. Not forgetting that a one-on-one discussion, appraisal discussion, is likely to raise the amount of detection of formalizing assessment of professionalism. Interesting is this PMEX, which I thought I'll share with you only because it needs little training. It stands for Professionalism Mini Evaluation Exercise, described first in 2006 as a preliminary investigation. Its focuses was on the professional behavior. It encouraged feedback, self-reflection and awareness. Settings can be in numerous places. Workplace-based predominantly is what's used. It does take 15 to 20 minutes and it's good to have a 360-degree feedback taking place. It's been evaluated in Japan, Italy and Thailand. I could not find studies in India, so that's something for us to take up. It has a 4-point rating scale, UN being unacceptable behavior, BEL being below expectations, MET being met expectations based on the level of experience of the student you are evaluating. exceptional performance being an outstanding physician to be, because we're looking at students predominantly, and also recognizing that there are critical incidents or events which have taken place in the ward which requires to be escalated probably to a management level, because that is certainly out of the purview of our assessment of professionalism per se. The strengths, of course, they're valid and they're reliable and they cross culture. There's not any reason to believe it will not work in an Indian setting. It needs little evaluator training and it's directly observed, it's formative, providing timely feedback. The weaknesses, of course, is that you can't have my peer assessing me, especially me since I'm much taller. Failure to fail phenomenon exists where evaluators don't like to fail others, and we're not too sure about the impact of such a tool. But remember, we learnt yesterday about the utility of whatever assessment tool we take. And van der Vleuten's equation includes reliability, cost effectiveness, validity, acceptability, and feasibility. Together, that decides the utility of an assessment tool. And it's very clear, as in an article published in 2017 and 2004 by Lee and Lynch, that professionalism is an arduous, multi-dimensional concept, very difficult to quantify, and it has very limited evidence exists in support of the utility of individual measures. Therefore, it appears that you need to use a combination of assessments, preferably by direct observation, which means time, cost, and of course, faculty numbers. The Johns Hopkins University assessment, as was mentioned yesterday, has a diagnostic before you actually enter the student into the system, formative as he goes through his 4.5 years as an undergraduate, or summative at the end. And it is beginning to feel that a formative assessment, multiple formative assessments will achieve a assessment for learning of professionalism, given the time constraints we have in our medical schools. But certainly the place to start appears to be postgraduates, where we can really focus on professionalism, giving the ratio being better, and the fact that we tend to work very closely in workplaces with them. Other articles talk about this formative, the move away from summative assessment of professionalism to more formative over time, and remembering that the portfolio is very important in such a thing, especially a reflective portfolio, because this portfolio can then be sat down together face to face, preferably with a group, a crowd, remember the crowd, of people discussing the portfolio to facilitate reflective learning, creating ability for multi-source feedback, and even patient feedback questionnaires being submitted periodically at multiple times. The problem is, after you assess professionalism, what next? Do you send Sanjiv away because of his misconduct, or do you accuse him of academic deficiency alone? An academic deficiency is probably something which can be reversed, which can be learnt, and may not be it is well-intentioned, but it certainly is simple mistake as compared to a very intentional or the loss of good intention where it considered to be misconduct. So the problem is, when you assess professionalism, you are sitting on a fine line, because you may pick up things which may require reporting for misconduct as against just academic deficiency, and it's good to know about that. So what is the blueprint? So Tejinder's group in 2014 spoke about, he's outlined the first MBBS, second MBBS, third MBBS, internship and residence. And it's important to mention that Tejinder Singh in 2014 was in CMC Ludhiana, where I think they had 60 students. So be aware of that. It's going to be a big challenge for many of us going forward, but at least it gives us place to think and a starting point to try and design something. So I tended to change that to make it little simpler, mainly because I'm a little lazy and I did not know many of these things. We do have the ATCOM right now going on, We have undergraduate log books. We can always add a small ethics prize exam, and we can consider, very importantly, training faculty of training them of how to assess professionalism. Going forward, you can take the PGs and the interns and create a forum, ethics forum, which is very political and therefore very exciting for them to be present to discuss ethical dilemmas, especially when it involves their teachers. So I have nothing to do with that, but I'm just saying that. Thinking about utilizing the PMEX for interns is a step forward. Again, faculty training being important. Ultimately, nirvana is when you have multiple source feedbacks taking place. You have this beautiful portfolios, face-to-face appraisals, and faculty training remains important there. Remember, we do have logbooks. I personally have written more logbooks in my first month in medical school for obvious reasons. I wrote everybody's logbooks who were senior to me. So I do remember that, and that unfortunately is an issue. Again, it's because of faculty not understanding the role of a portfolio and logbook, and that's something which we can strengthen to assess professionalism. In summary, we do need professionalism. We do need to assess it because assessment drives learning, and assessment is king. You can have simulators, all those things they spoke about. Okay, AVM and Ram Nair. But as long as I am the examiner, I don't ask it in the exam, whatever he learned doesn't matter. So ultimately, assessment is king. We need to look at ways to assess using the Miller's Pyramid, content tools, consider the PMEX. Remember, multiple factors, multiple tools to be used, and preferably a collective judgment on the professionalism given the multi-contextual and the multidisciplinary aspect of professionalism. Thank you so much for your patient listening.
Any questions?
Thank you for your wonderful presentation, sir. St. John's is one of the few medical institutions in the country having a department of humanities. This department was established in your institution much before the erstwhile Medical Council of India recommended that the hidden curriculum become overt and be assessed. So my question for you is, does the department play any role in curriculum development and assessment of medical students?
Okay, so they put me on the spot. But since I am now retired from St. John's, but on a contract laborer right now, so I don't mind answering now. So we've got a Department of Medical Ethics, which has been teaching ethics. We have an Institution Ethics Review Board, which is the scientific research like most institutions have. We have a Hospital Ethics Committee because we're a Catholic institution and we have certain challenges with regard abortion, MTPs, and even beginning of life issues and antenatal diagnosis. So we have challenges there. So we have a Hospital Ethics Committee. We have a Department of Ethics, Department of Humanities, as you rightly said, which is a division of humanities under the Research Institute. And they have this beautiful history of medicine museum. And it was all developed by one person who really spent all his life there, Dr. Mario Vaz, who's a physiologist. And he's done a lot of work in ethics in humanities. His wife is also heavily into humanities and she runs the department now. They do not play an active role, but they have programs which are very attractive for students. So students spend time outside the regular hours, spending time with them, writing poems, reading books, publishing books, discussing matters which really matter, art, drama, a lot of humanities is mixed there as part of it. And I'm sure I can share with you their number as well as thing to learn more. I've been on this ambition to bring them all together because I would love to have an institute of bioethics where everybody is together teaching, researching. That's been a big challenge for me going forward. But a wonderful department, the students love them. So there is a hidden agenda with students, and I'm sure you know that because I had a hidden agenda throughout my medical career. So we all had hidden agendas, and they are very attractive for the students, especially undergraduates. So that's where their role plays in. I wish there was more interaction. It takes a lot of time. It's like medical education. To get them to work together, oh my God. So,
Sir, in our medical profession, one of the unwritten code is the dress code, which nobody talks about. And you also didn't touch upon the universal presentation. What's acceptable dress code? What is any literature or any tools are available about the dress code? Because we also facing this. Oh, I am in a Western country where part of dress is not that traditional, but still we are facing the problem with this dress code. So dress code is a universal problem, but I have not seen any tools talking about dress code.
see, sir, I presume you're presently not in India. Are you one of the Antigua gang? Yeah, it looks like it. Okay, all these,
I'm not
these
in India,
Caribbean
but-
chaps and all that. Okay.
But from 2 years, just from 2 years, I am not there.
Okay, so I think professionalism is one component of professionalism is a dress code, but I don't think anybody can dictate the dress code. I think it has to be culturally appropriate, and I don't think we can say, okay, the national dress code is orange tie with blue shirt and pink pants, and I don't think we can do that because it's going to be very difficult. I think a lot is to do with professionalism is all about the culture of the environment in which the institution exists. So each institution has a different culture, and I think you need to look at your culture, but I understand your university has got a lot of American, that also Caribbean, which makes it more difficult. I think that's up to the institution to decide its culture and therefore what is acceptable professionally for students and staff to have a decorum. Like you go to CMC Vellore, everybody's got white shirt, black pant. Just to let you know, the first time in my life I've seen Nachiket yesterday in a brown color shirt. I never recognized him. So he's one of those Vellore chaps, white shirt, black pant. The culture used to be like that. It's changing now. I don't have an answer to you except that it depends on the culture of your institution and what you consider professional in the way you dress. And maybe one way to look at it is, would you like a doctor to have short pants, t-shirt saying, who cares? Walking in and saying, how are you today? How's your headache? Okay, weakness of the right hand. So I don't know how to answer that, sir.
I think the talk was very interesting, and we are short of timings also. You have stressed the direct observation and reflection and feedback are very, very important. But the major issue, probably the large number of students in many colleges with a few number of faculty. So unless you show by example, most of people believe that professionalism and ethics has to be caught, not taught, because whatever theory you talk, it is fine, but in practice probably it does not happen. So is there any solution from you to match this large crowd of students with the less number of teachers?
I think the teachers who are not in this room, they should be in this room. I think the type of teacher we're getting, so I'm not talking about seniors, but I'm saying the teachers we have now, there are very few teachers. And I think the joy of being a teacher is so important. The want to, do well for you, to inspire your students. I even wore my tie today. It's the second day in a row, Mahalakshmi, okay? I'm just saying it's exciting to be a teacher. You may not get the financial rewards, but it's so exciting because you are a needed person, you drive the system. And I think unless we get teachers for the right reason who come here to become doctors, to want to teach, you're not going to really spread the news of professionalism. Thank you, sir.
So the last comment.
Segal, ma'am.
Actually, it's parallel to what both of you are discussing. I was just thinking since yesterday, it's the teachers who are wanting to assess the students. Why not reverse the situation? Why don't we create a cell of students who are to assess the teachers, because then the teachers are under the compulsion of what you are wanting to state. You understand? You now see the college magazines and the comments are who is the best dressed teacher, instead of who is the most ethical teacher or best teacher. So this is also an answer to you. We must inculcate that amongst the students, because the reverse will start happening once the values are being, everyone wants incentives, but instead of that, I think what we are talking today have become the biggest disincentives for anybody who wants to practice ethics.
Thank you, ma'am. That's a very good comment. I'm going to add to that. I started a Best Teacher Award in St. John's, and I was made to set the assessment tool. And guess who won? I shall not mention it loudly. I did win, but I was asked not to, because I designed the assessment tool. So I looked at myself in the mirror and I wrote down why I'd do well. However, that year I was bummed because I had set it. I was not allowed to win it. I won it the next year, and then I got beaten every year for the past 15 years, and I'm waiting to trip him. That Nachiket kept winning it after that.
Anyhow, thank you very much. I think we are short of time. So there will be a lot of questions which I think he will be very happy to interact with all participants. And thank you organizers for allowing.
Thank you, sir, for enlightening us on this, navigating to the topic, which year we have to do, how we have to do, and these face-to-face appraisals was very good. But I would like to share also like the postgraduates' professionalism, which was in the upper level of unethical or whatever, or not meeting the expectations. They even induce the students, interns to commit suicide. I have witnessed such things where they are stressed with so much of work, both faculties as well as the postgraduates and the interns. So it's such an important thing that professionalism has to be taken very seriously in the coming years, because the interns are very fragile. They have been brought up in a very safe environment. They cannot, and we don't see whether they have time for food, rest, sleep, or they're able to manage so many cases. They want somebody along with them, which always we're not able to provide. So I thank you so much for this. Amidst wit, humor, you have taken serious things into this talk. Thank you.
Thank you, sir. Thank you, ma'am. Thank you, sir, for your insightful session on assessment of professionalism. I request chairpersons Dr. B. Vishnubhat and Dr. K. Kavita to honor Dr. Sanjiv Lewin. Thank you, sir. May I request Dr. Deepti Shastri, Deputy Dean, VMKVMC, to honor our chairpersons.